Good afternoon and welcome back everybody to the roundtable, The Future of Health. I'm still Enrico Noseda from Cariplo Factory, the ecosystem catalyst of Federated Innovation. Let me tell you a bit about this session before introducing the other speakers. The session will bring together companies from the life science and healthcare thematic area, which includes 7 companies plus 2 who have just been added that I will introduce in a second. During the main session a while ago, we heard the chairman of Federated Innovation, Tommaso Borralevi, illustrating the state of the art of the network, while the innovation ambassador Paola Testori-Coggi and Federico Frattini shed light on the importance of the innovation agendas of each thematic area. In the following 90 minutes or so, we're going through deeper details on topics, objectives, and upcoming innovation initiatives belonging to this thematic area. We will do that by starting from the innovation agendas, the backbone of their strategy, representing the results of the joint effort between member companies and the ambassador, with the support of us, Cariplo Factory, as catalyst. As Eduardo explained, we've been developing this piece of work in 3 months of intense cooperation, intense collaborative effort. We started from a broad analysis of the scenario of the market, leading to the definition of the strategic domains. Then we focus on the challenges and opportunities, getting finally to objectives, key results, and eventually the innovation initiatives. Thematic areas, I guess you understood that from what we've been talking about in the last few minutes. They play a crucial role for the entire ecosystem. And cross-pollination is one of the main features of the model. And indeed, one of the priorities of the 11 thematic areas is to identify synergies and areas of collaboration between each other. This is exactly another item we're going to discover during this roundtable. The links between the various thematic areas and the links between thematic areas and Federated Innovation and the broader ecosystem, in particular from the anchors. This top-down model starts from the vision and the strategy of the members of the thematic area. It's just one of the approaches we will be using to accelerate innovation within Federated Innovation. There is also going to be a bottom-up approach where we are expecting talent and startup and businesses and the broader innovation ecosystem of Federated Innovation to propose projects and initiatives to the members of Federated Innovation through the digital square. I'm saying that again. I know this has been explained by Tommaso before and by myself at the very beginning of the session. If you're listening to this session, you find anything interesting, go on our website that we call the Digital Square, and you can enter details about yourselves, about how you want to cooperate with us. You can also download the innovation agenda of each thematic area and see what's boiling and where you could contribute. As I said, there will also be a Q&A session at the end of this thematic area session, and we are definitely eager to receive inputs, comments, and questions by anybody there. If you want to ask a question, there will be a button, a chat button on the top left of where you're watching it right now. So before starting with the question, let me introduce the speaker that will keep you company for the next hour or so, who contributed to the working session of their innovation agenda. Let me start with Andrea Pagliai, Life Sciences Lead for Italy, Central Europe, and Greece at Accenture. I'm asking, yes, fantastic. Andrea, good afternoon, and we're really eager to hear from you in a bit. Then we will have Marco Gorini, Head of Healthcare Innovation from AstraZeneca. Moreover, Fabrizio Grillo, General Affairs, International Relations Director at Bracco.
Enrico, good afternoon, everybody.
Good afternoon, Fabrizio. And then Stefano Cantù, founder and member of the board at Life Science District. Good afternoon, Stefano.
Good afternoon, everybody.
And eventually, for this initial block, we have Marco Proietti, Home Care Business Manager from Nippon Gases.
Hi, everyone. Good evening.
Fantastic, Marco. So there you are. And we're not going to introduce the remaining speakers for this session. This platform can accommodate only 9 at a time. So we're going 2 blocks here. So I'm introducing Laura Antonioli, Medical Innovation Lab and Compliance Head at Novartis.
Hi, everybody. Good evening.
And then Roberto Orsenigo, Medical Franchise Leader at Novartis.
Good afternoon, everybody.
Paolo Patri, Chief Technology Officer, Stevanato.
Good afternoon.
Good afternoon, Paolo. And Luca Martini, Sustainability Lead, still at Stevanato. Fantastic. And finally, we have Andrea Teja, Head of Digital Innovation Transformation at SynLab, which is a new member to the thematic area. Good afternoon, Andrea.
Good afternoon, Enrico. Good afternoon to everyone.
And last but not least, Daniel Eriksson, Scientific Director beside you group.
Hi, good afternoon.
Good afternoon, Daniel. So thank you, everybody, for this very brief introduction. Let's move over to the round table where I will be asking everybody before maybe intervening to very briefly introduce their companies to make everybody understand what you guys do at the start of their speech. So as a starting point, I would like to kick off asking to some of you the reasons why you joined Federated Innovation at Mind. And let's start with Bracco and AstraZeneca. So I'm calling Fabrizio Grillo and Marco Gorini back on stage to explain the reasons your company decided to join this fantastic ecosystem.
Thank you, Enrico.
Who wants to start? Fabrizio, let's go for it.
Okay, thanks a lot. I took the place. Okay, good afternoon, everybody, and thank you all. Bracco is a worldwide company on imaging, and very well known, of course, in Italy and everywhere. A 90 or plus 90 company history, which is very strictly connected to our roundtable today, to our subjects. First of all, let me spend a very few seconds on thanking all you guys, starting from Tommaso, Edoardo, Enrico, of course, Eleonora. And I sure forget someone, but it was a long way to get here today. The step is not easy. Calling to an open platform a couple of, let's say, companies or industries in Italy is not an easy exercise. And okay, we are with you just to give the example of what we did during the last couple of weeks, reminding that aircraft engine that you project at the beginning, with all the areas that are very close one to the other. So this is the way I think we can manage this project, which is very ambitious, very challenging, because it talks about everything, tech transfer, open innovation, and so far a lot of other things that I'm running, so I can wrap up everyone. Last but not least, I was very surprised and excited when Tommaso was looking around the expo area, which is for Bracco a very, let's say, emotional area, but very exciting and very challenging for the future. So That project was in 2015, and in 2016, a new huge project started, and we are here more or less five years later. But I think that we can run just now and have the opportunity to make a really great ecosystem. About the question, we believe as Bracco that such an environment gives, let's say, the conditions, the right condition to foster private and public partnership, where companies invest an important amount of resources, bringing to a market and to a unique system in Italy, as you mentioned just now, with a pre-competitive environment where companies of the same market can collaborate instead of competing. That's not easy. And where, as you said before, contamination between different sectors is possible, and it's not obvious in Italy or everywhere around. So it's a really unique experiment till today. This creates today, I mean, in Europe, I know that in the United States, a lot of them have a really huge success, but in Europe it's not so easy. This creates the right environment for innovation. Bracco sits both in the layer 1 and the layer 2 of the Federated Innovation, which means that as a company, we have the chance to influence the innovation strategy of the whole ecosystem, but also we can help to drive and take part at the projects coming from the companies in the life science thematic area, collaborating one with the other and with the making innovative possible tools. Last but not least, the MIND project, in addition to creating new ecosystem on innovation, represents, let's say, a major investment attraction project in Italy, and thanks to the choice of Lend-Lease, one of the largest group in the world for the development of urban context, the new towns all over the world, which has chosen to invest billions of euros on it, is a preliminary condition that is very important. I conclude saying that this choice is even more important because further investments attraction are underway by other global players. It is a great investment attraction plan for us. And thank you to those collaborations. The ecosystem hopefully will finally be able to play a key role and will truly be able to positively and effectively influence the future of life science. Thank you, Rico.
Fantastic, Fabrizio. This was very, very interesting. And Marco Gorini from AstraZeneca, can you, what was the reason why you guys joined? And if you can make just a very quick overview about AstraZeneca. Not that
Sure.
Not that is needed, but just to.
No, good afternoon, everyone, and thanks for this invitation. Yeah, AstraZeneca is a global pharmaceutical industry that focuses on research, development, and commercialization of human drugs. We're also part of as layer 1 of this MIND initiative. And let me echo what Fabrizio was saying. I tend to agree. I mean, the idea that the really key word is collaboration, and this is something that also in the first section came out quite clearly. So the Federation Innovation gives the opportunity to create a unique environment where private companies and public anchors with a clinical scientific vocation can put their skills, experience, vision to create innovative digital solutions to generate an impact for the benefit of the patients. So I think the main goal is really to increase the magnitude of impact of long-term projects. This is what we can do, working together. And all this is in line with our values at AstraZeneca. Basically, we are committed, of course, to improve patients' lives, addressing the different pain points of the patients. So basically helping them to cope with their disease and overcoming the daily barriers. And I think that we know that we are producing, drugs as the mainstay of treatment, but at the same time, we fully recognize that the health scenario is changing very rapidly. So digital health solutions that we are playing and will play a crucial role in this evolving scenario. And we're also transitioning to a new model where the patient is treated multidimensionally over his course of the management of the disease, and not only in hospital, but beyond the hospital. Furthermore, there is a huge value of data. Probably will be discussed that later on, but now really we can get and gather real-world evidence data and include that in the story of the patient. So we think that this will change the approach to diagnosis with probably an unprecedented capacity to intervene early and delay the establishment of chronic diseases. So for all these reasons, bringing ideas and companies together in Federated Innovation is the right place to be at the moment. I mean, we can bring ideas, projects, share them with partners that for sure will add value, will add valuable inputs, and will ensure a deployment with a broader impact for patients' lives.
Thank you, Marco. This was super interesting. I love this thematic area because the topics are so relevant to everybody's lives that is I think it's really important what we do here. So both yourself, Marco, and Fabrizio before has mentioned multiple times collaboration and competition, and it's quite impressive what we're trying to accomplish. Federico and Fabrizio mentioned that before. It's a big challenge. It's a big challenge. There are players that are direct competitors here. And how can you work together? I'm now asking actually Andrea Pagliai from Accenture if he can comment on what you just explained. So basically, how is this gonna happen? Collaborate to compete. It's a fantastic theory. You can read about it in books, but then at the end of the day, you need to implement it. So what do you guys think from the Accenture point of view?
Hi, Enrico. Thanks for the question. I don't know if you can hear me.
Yes, very well.
Thank you very much. So I think I'm not going to do this Accenture. I mean, I think all know that we're a very global player, multinational professional service company. We have a strong presence here, so I'm very happy to be here with all my colleagues here, bringing our experience, global experience and local experience in the life sciences and in the health industry. And going back to your question, well, challenges and opportunities always run together. Today, you can never innovate being alone without having multiple actors working heftily together. And this is not just a matter of this industry, let me say. It's true everywhere. And this should be recognized by all of us, by all the actors. The future is coming very fast. Patient expectations are evolving faster and faster, maybe even faster than any actor in the industry value chain so far. We are listening the market, we are listening the patient and people that are taking care of about their life. And our last global research are telling us that people are definitely not very well satisfied by the current way on how they access and manage their health. And this is different, but almost true everywhere. They see new technologies and digital services as a way for definitely improving it, influenced by the liquidity expectation generated by other industry, other sectors that now the barrier doesn't exist anymore. Comparison is easy to do by anybody. This trend obliges all of us, I mean, new actors and current players to innovate fast, being definitely more connected. And this is a place that we build together to be really connected and work together, able to share info, data, technology, making, let's say, all of us responsible in managing the patient service experience, their adherence to the cure and their life. The creation of such competitive arenas, aiming at orchestrating and steering at the right speed by all these actors in defining new industry strategy approaches to deliver creating new ecosystem technology and platforms to work together, and measuring in, let's say, in a debatable way and collaborative way the results is more than one objective that we are trying to put in our table in this exercise. This is definitely the arena that allows all us and all the actors in creating the future, innovating, bringing the required multiple different skills together, and for our contribution to bring to all our local and global experience to do it.
Thanks, Andrea. As you're on stage, I would like to dig a little bit deeper on this. We heard before from Tommaso and from Eduardo, another important element is the cooperation, as you explained, in the direction of a systemic approach and the connection between federated companies' innovation needs. So sometimes we like to say we are beyond open innovation. What do we mean with that? What's your take on beyond open innovation?
Yes, as I said, we have to realize that we don't go anywhere alone in creating the future, especially in this context, in this industry, especially when we have the ambition to shape and realize the future in the healthcare. That's a must. That's something that we need to bear in mind. And today we are beyond the open innovation concept because we really need to innovate. We need to manage multiple competencies together, talents. We need to attract and be able to attract multidisciplinary teams all together, working together, like how we are working in the last months that you mentioned, and the future months that are in front of us. We need to convene powerful partnership. Working in a collaborative, open way in open context means that potential competitors, I was listening before what my colleagues are saying, we need to find a way to collaborate, to orchestrate all different actors, even actors that are working in different industries, because they need to work together live in the future around our patient and our people. We need to build together the integrated delivery models and arrange the different multiple technology that in most of the cases should be shared among all of us, all the players. So Federated Innovation is aligned on this principle. We, as Accenture, we are even working inside us. We are organized in a way that it's mostly aligned with this principle, because the future should be designed in this way. And should give all of us, the chance to bring all the different experiences and lessons learned together for the benefits of all participants. And at the end, everything is built around patient. It's been about human being for all the actors that are involved, and we need to consider that.
Thank you, Andrea. I'm also asking the same question to Fabrizio Grillo from Bracco, if you can join us on stage. Again, this is really a fascinating topic. So what's your take on this, Fabrizio?
Okay, thanks again for giving us the opportunity to explain our goals, our vision. Let me just go back for a minute to what our ambassador Paola Testorico just said. She launched 4, let's say, challenge: ecosystem, private plus institution, if I'm not wrong, investors, of course, interconnections of city in the future and city that we live every day. So the comparison between what is the project and what is looking forward and what is today. Openness to attract partners, because it's always vital that new partners come in a project that is running, and the right balance for AI and rights. And she was talking about data sharing. So very, very sensitive items, very particular, interesting, difficult. And that's another mission, another goal that we are trying to do, participating to this platform. If I may add, as a central element to get on the ground the answers to the challenges of health for all, and to give concreteness in the short term to the great concept of One Health Challenge. A lot of scientists, a lot of Nobel Prize, and it's really a never endless list of people taking the bad period that we ran last year and this year with COVID, insisted in managing not only the idea, but the practical delivery of One Health Challenge. And we are convinced that the most appropriate strategy is to correlate investment projects not only to the new framework of the PNRR, and in particular for mission number 6, but together with these to the complex system of policies and financial resources at European and national level, foreseen for the period 21-27. The real challenge will be to create synergies between all financing opportunities and investment projects of companies and ecosystem in the world of research, in connection also with the university and research center context. Mind, on our mind, let me joke a little bit, represents for this challenge the most attractive, the most necessary and effective tool, both for the use of resources, but above all for competing at the European and global level. Italy has launched an important strategy for the development of a strong ecosystem of open innovation in the country, thanks to the National Innovation Fund, but as the goal of sustain with the risk capital the challenges of the startups ecosystem in Italy. In such a context, we think that MIND represents an extraordinary instrument of competitiveness of the strategies of open innovation at one side of the Italian companies towards the other European and global ecosystem. Thank you, Roberto.
Thank you, Fabrizio. You've been very, very clear. And the keywords we keep hearing are systemic approach, beyond open innovation, participation, common good. These are really the core elements of federated innovation, like we've been trying to explain since the beginning. That's why I would like to broaden this roundtable to some other players as well. Laura Antonioli from Novartis, can you give us your take on this?
Yes, sure. Thank you, Enrico. And let me introduce very briefly what is Novartis, yes. Even if I think that most of you are aware that Novartis is a multinational pharmaceutical company. Is among the national market leaders in different therapeutic areas like cardiovascular, respiratory, immunology, and transplant and neuroscience, and so on. But also we have a huge component in oncology, and a part of our group, it is also Sandoz and AAA. This is Novartis, and our mission is reimagining medicine to improve and understand the patient lives. But about your question, that I think it is really important. As Novartis, we have 3 main topics supporting our participation in MIND. And all these 3 topics are working around 2 words, that are partnership and collaboration. About collaboration, the first point is for improve the patient journey. The other point is collaboration in value-based healthcare. And the third point is collaboration in research and development. If you want to go more deeply in these 3 points, we firmly believe that an improved patient journey leads to better patient outcomes. And that is really important to us. Starting from this, Novartis has been investing in the education and services, supporting the primary care physician and specialist. And it is looking at the opportunity for co-creating activity value-based. And this is clear, one of the biggest reasons why we have joined Mind. We are willing also to explore innovative partnership inside and outside the life science space to contribute to support healthier life condition, reducing also pollution, improving nutrition, and sustaining mental and physical well-being, as well as supporting patients with chronicity. The chronicity is a really important part that is increasing in the economy of our country. By integrating data science and digital technology, we aim at raising the quality and the interoperability of data. And this is really important for research and development. Promoting a best practice in the methodology, sustain access to data by all stakeholders, improving trust and acceptability. Last but not least, we are looking at Mind for its potential to establish private-public collaboration in research and development. That is one of the most important goals that I think Mind can reach together with all the partners involved.
Thank you, Laura. That was a very, very complete overview, and I know we will be digging deeper into many of the elements you mentioned as we move into the innovation agendas in a few minutes. I'm asking Paolo Patri from Stevanato to join me here, and the topic is still about collaboration and cooperation. What's Stevanato's take as a relevant player in the thematic area?
Thank you, Enrico, for this invitation. I'm glad to answer on behalf of Stevanato. With 70 years of experience and recently being listed also to the New York Stock Exchange, just to clarify, Stevanato is a global science technology company providing drug containment solution, drug delivery, and diagnostic solution for pharmaceutical and life science industry. Our capability relies on scientific research and development and strong commitment to technology innovation to offer value-added solution to patients globally. And this is why, for us, innovation is a big opportunity. However, we are conscious that pharmaceutical research and development lives since decades a productivity paradox. The more the companies spend, the less innovative products are getting out of the R&D funnel to go on the market on time. And to overcome this paradox, the R&D model has moved from closed innovation to open innovation. Now we are the strong believer the acceleration is possible thanks to innovation network based on private and public partnership among academia, public institution, private company industry, and even startups with positive benefit also for the territory. Participating to the Federated Innovation, we aim to co-develop innovation in a pre-competitive environment, also across different industry sectors, to have a positive also environmental and social impacts. In particular, at Stevanato, we see the future innovation at the intersection of the healthcare market trends, focusing on patient centricity, facilitating transition from the hospital to the home care to improve patient quality of life, developing advanced technology for the treatments of the future, as COVID-19 has also explained, and develop a value-based healthcare solution. But in conclusion, we are a strong believer that all these challenges require a wide set of competencies that are beyond those that any individual company could build. And sometimes it's even difficult to find within the same industry sector. And this is why, for us, we think that Federated Innovation could be the right place to collaborate to create innovation. Thank you.
Thank you. Thank you very much, Paolo. What I really love about this project, Federated Innovation, is that I see companies really putting their actions aligned to their words. Again, we keep hearing everybody talking about open innovation on the market, but there's very few companies who are really accomplishing that. And I think what you just said and your colleagues before, I think this is the proof, the demonstration that this can actually work. Again, I want to highlight once again that we have in this room a few competing companies that have joined forces to collaborate and build something for a better good. And this is almost unheard of. Let's now move more concretely into the innovation agenda of the thematic area. So in the next few minutes, we're going to focus on the content of the innovation agenda. We've been working on that for the last 3 months. We're going to talk now about the strategic focus and landing on concrete and pragmatic initiatives that you want to implement, we want to implement. Let's start with value-based medicine. Let's understand more what's going on here from Marco Gorini from AstraZeneca. So we tend to think of patients, whereas the patients, are in fact citizens. Is there a way to fix this journey, maximizing their value and their quality of life and creating at the same time a more effective process?
Well, I think, Enrico, the answer is a positive one. There is a way, and for sure, value-based medicine could be an answer. And in fact, I think all the collaborative effort that we are having in mind between mind stakeholders starts from systematic approach to the map of the diagnostic therapeutic path with the related pain points that basically are targeting the need that are not properly met in the life of citizens on one side at risk of developing a disease, but also on the other side, patients that already are affected by a disease. So expanding the possibility of intervention outside the classical places used for treatment, while instead creating a continuum between the city of the future and the hospital of the future. And this interconnection really, it's something that we want to explore in mind and that we think it's really relevant for our thematic area. So to improve the quality of care while maintaining economical sustainability, it is necessary for sure to foster the concept of maximization of patient value. This is not easy. It's not easy because the value-based medicine, in fact, marks the transition from performance and volumes of activity to a logic focused on concrete health outcomes for the patient, taking into account different factors, also direct, indirect costs that, in a way, incurred to achieve these results. So to be very pragmatic, concrete, you were discussing about being pragmatic. Let's imagine and let's reflect on the impact, for example, of home care delivery in terms of quality of life for the patient. Paolo Patti was alluding this 1 second ago in terms of the importance of the home care delivery. Or let's imagine a patient that doesn't need to go to the hospital in terms of effort and burden of time and money to go there. So there are a lot of factors that need to be taken into account that will allow measurements of results in terms of health and costs that take place probably over a wider time frame. So we need a little bit to move our point of reflection here, considering not only the immediate post-hospitalization cost or the first months after admission. So I think this is a very ambitious goal that we have as a thematic area, and to exploit these companies, this concept that the companies part of this life science and healthcare thematic area are willing to explore innovative partnership. You've been hearing so many times across industry sector, and this is exactly the case. So a partnership to contribute to support healthier life condition, reducing pollution, improving nutrition, and sustaining mental and physical well-being. So we truly believe here in mind that the opportunity in order to succeed in this scope is to collaborate and co-create a project framework with other mind asset industries outside our group. So for example, just to name a couple, we envisage a cross-sector collaboration with the big players of retail and supermarket chain like Esselunga, or good and service retail like Enel and Poste Italiani, that can bring the clinical solution as close as possible to the citizens first, and patients then in their life.
Thank you, Marco. That's very clear. Fabrizio, can you join me back here? There's a very clear, there's another very clear area of opportunity out there on the development of a healthier environment in our cities, to prevent chronic diseases. I think we mentioned that before. Which is also a very interesting link between the two pillars at mind, life sciences on one side and city of the future on the other side. How can this be addressed by this thematic area?
Yeah, thank you again, Enrico, for the opportunity. Marco, in the previous intervention, told a lot of things that are really connected to what you're asking to me, and I think that's reminding the three let's say, recommendation that Federico Frattini, the other ambassador, together with Ambassador of Health Science, told Paola Testori-Goggi. Federico talked about sustainable development. That means green tech, life science, and a lot of other things that are very, very closely connected. Then the commitment that is pushing together to get to these ambitious targets, like energy mobility and a lot of other, let's say, sectors that are really linked to this stream. And third, the attention to improve quality of life. So before becoming a patient, you need to live a good life that is guaranteed by a right level of services, prevention, precision medicine. Those two things are very important for Bracco now, and also for our CDI, which is around Milan, let's say, a place for giving services for health only on a daily basis care. But really, I mean, it's very very important for us. And we know that chronic diseases have long been the leading causes of death in non-developed, but also in developed countries. And more than 70% of deaths are due till now to chronic diseases. So the prevention of this is very important. That requires whole of society or system strategy. And thinking about prevention requires the adoption of new concepts and tools coming from multisectoral and intersectoral ecological and planetary intersection. I mean, we are looking outside our borders. It's not possible to close anymore. So looking more systemically at chronic diseases is important. It's strategic given the complex interplay between the many different risk factors and outcomes. In our thematic area, we would implement, and we are implementing, the approach for preventive medicine. That could be, as I mentioned before, in a principle scalable to the planet and its people. This approach links prevention of chronic disease with sustainable development and ecological system within an holistic perspective. New opportunities for prevention research are also strictly connected with data, and what Marco said before, technologies such wearables and smartphones and precision medicine. So at the end, in our opinion, the life science and healthcare thematic area would target in the long run to the development of a compelling case for greater investment in effective system-based and equity-focused prevention, supported by a model of policy-relevant research that is co-produced and collaborative.
Thank you, Fabrizio. And I'm calling Marco Proietti now, and expanding on Fabrizio's point about technology and data. We see an opportunity out there with the electronic health record, and aiming at a better use of technology to make different stakeholders collaborate in a different way, ensuring access to health care services everywhere and at all times. How do you see this opportunity?
Well, Enrico, the digitalization of healthcare is an unmissable opportunity for the evolution of medicine. I think the real revolution is not to apply technology to medical practice, but to create an increasingly appropriate health protocols, even personalized to individual patients, using the technology we have available today. And this protocol can be integrated and constantly managed in all the aspects that revolve around the management of patients, such as, for example, specialistic doctors, territorial doctors, drugs and drug delivery systems, medical device, and home care for sure, because the home should and will be the principal point of care for patients in the future. Therefore, the new technological tool allow cooperation between all the players involved with the patient, even if they are distant from the patient, and provide doctors with a more complete and always updated anamnestic picture. Also, thanks to the possibility of continuous monitoring of patients' parameters with modern technology. So, in addition, I think that the dematerialization of the care pathway and the continuous monitoring of patients make healthcare always close to each individual in every situation and in every circumstance. All this can be translated into one sentence, ensuring the best therapeutic appropriateness for the patient. This is the real goal, all we can score with telemedicine. And finally, I think we can also make the most of technology available today to ensure easier and faster access to healthcare pathways, guaranteeing the patient a better lifestyle. All this is value-based medicine. So, technology, electronic health journal, dematerialization of health pathway are the base to realize a concrete value-based medicine.
Fantastic, Marco, and thank you for your support there. I think we are almost at the end of this first block about value-based medicine. I'm asking Laura Antonioli back on stage from Novartis. Again, we have been talking about pragmatic approach to innovation, and so we also have a very clear plan of initiatives. Can you make some examples of what we are thinking of to address the above points?
Sure. And I have to start, of course, from a project that is considered in our thematic area as the ground for all the other initiatives that we can start inside our playground. The need of digitalize the healthcare sector is not new, for sure, but we would and we could, as a thematic area, contribute in accelerating the process. So the big, bold project around which we are all agree is the creation of a real-time big data open platform. This big, bold idea will allow to build many other initiatives with the characteristic to be based on the real territory's needs. That is really important. Usable and measurable. By itself, this project will allow to review therapeutic diagnostic pathway and patient journey, making innovation and personalized medicine sustainable, inclusive, and affordable. And moreover, giving to the science the chance to make easier and faster the research for even better health. For all this point, we have opened a dialogue with UNIME, Milan University, because we need a credible pilot to scale. That is in a very short time my answer, representing what we are thinking in our thematic area.
Great, Laura. That's a very pragmatic way of expressing our pragmatic approach. So thank you really for that. Last question on this block is to Paolo Patri from Stevanato, and I'm wondering whether sustainability can be a lever to maximize value for the patients.
Thank you, Enrico, for asking this very important question. Sustainable Development Goals by United Nations require a new regenerative holistic model, as also Professor Federico Frattini illustrated in his speech a few minutes ago. But for us, there is more than just a mechanistic correlation between the sustainability and the environmental impact. In the healthcare, the focus should be the entire patient journey, from integrated continuous engagement to treatment, leveraging digitalization. This will provide more value with the medicine, improve patient quality of life, enhancing both adherence and clinical outcome. But aging population, chronic and rare disease are calling for better and more discreet self-diagnosis and self-administration solutions. In particular, we see opportunity in facilitating, as mentioned before, the transition from hospital to the home care to reduce healthcare costs. This has not only a huge financial implication, but also a very personal one for each individual. Because if you are a patient, you do want to forget to be a patient. And new drug delivery and diagnostic ops solution can help on this. And if they speak for sustainability, there is also the opportunity to reduce the daily cost for the therapy for the patient. Patient, as mentioned before by Marco, can be considered also individual citizen as part of a broader social community. Extend the affordability of healthcare services, improving coverage at better cost. Pursuing integrated solutions, strengthening the network of caregivers around the patient. In conclusion, this could lead to redesign pharmaceutical and diagnostic product, processes, and services, and eventually even the house and the city of the future, calling for a huge positive impact on people, community, and environment.
Great. Thank you very much, Paolo. I think we're now moving over to another of the strategic pillars of life science, which is digitalization. Digital transformation is changing the world very quickly, has already been changing a lot. In particular, during the COVID phase, this has been offering fantastic opportunities to companies to accelerate their transformation processes. I'm asking Marco Gorini from AstraZeneca. There are big challenges and big opportunities there around data. We mentioned that before also in the value-based. Data integrating system, using digital tools to elaborate information. How will you address these opportunities? Can you tell us the initiatives you're planning to implement?
Sure, Enrico. I mean, with digitalization, you're raising a key topic. Also, Marco Proietti before was saying it's an opportunity that we don't need to miss, and fully agree with that. So I think how to manage and integrate big data is a great opportunity today to build robust data marts where now you have technology available that you can apply. You can apply artificial intelligence. Now you can work with synthetic data, so you can provide marvelous outputs. So great opportunity on one side. We also need to recognize that on the other side, this is the typical barrier that we face when we want to interconnect different data sources. I mean, sometimes, very sadly, even when you want to interconnect two databases in the same hospital account, you struggle with that. So I think it's a very important area to work with, and we need to do that collaboratively. So the bold ambition that we have in mind is really to leverage on the innovation ecosystem that we are building to create a proposal for the next generation of data infrastructure, an open, transparent, and secure digital ecosystem where data and services can be made available, collected, and shared in an environment of safe and trust. I think the two ambitious goals that we have, the first project is to generate in mind a connection to Gaia X, a project initiated by European representatives from business, and politics, and science working together to create a federated and secure data infrastructure where companies and citizens will collate and share data in such a way that they will keep control over them. And then Laura already alluded to, and I fully agree with this project that is key in our strategic agenda. We are exploring a collaboration with the University of Milan as the public institution to connect the private sector and other research centers with the goal to create a data mart of many institutions in the Lombardy region. The project will start by exchanging preclinical and clinical data, create data lakes, standardizing the format, and sharing data over a secure 5G network.
Roberto Orsenigo from Novartis, I know you wanted to say something as well on this topic, so please come here.
Thank you. Yes, maybe just to give an example of what something that is happening just now. We are deploying an artificial intelligence-based platform that is aiming to connect the primary care with the hospital setting in order to improve the management of chronic patients. And it's a platform that we can also integrate, or we can offer in future for a future partnership, also in the context of mind. So there are some already living and concrete examples of these digital tools that we can easily make available to anyone that might have an interest here.
Thank you, Roberto. Precious addition to the conversation. I'm actually quite happy for the next speaker, which I'm calling on stage, Andrea from SynLab. I'm particularly happy because SynLab has just recently joined Federated Innovation. So it's a living proof that this is an evolving ecosystem. So these are, let's keep Andrea there. This again is the living proof this is an evolving ecosystem, and we are growing in numbers and contributions. Can you tell us what you are trying to achieve and what the most relevant opportunities for your company are there in the digitalization area?
Absolutely, thank you, Enrico. A few words on SynLab. So SynLab is a global company, leader in Europe for medical diagnostic, but not only. In other countries, like Italy, we also run our own medical centers. We are present in 36 countries around the world, 4 continents, 26 only in Europe. And we come to Federated Innovation, to the mind ecosystem, with a clear view. Because what really we stand out as SynLab is customer-centric medical excellence. In order to keep pushing that, in order to be agile and be able to give it also in the future, is really important and fundamental for us to innovate, to come up with new product, new services, new experience, a new business model, and whatsoever. Because our stakeholders are patients on one side and healthcare professional on the other one. So medics, nurses, biologists in the labs. And we really want to start with their need and understand how can digitalization help them. On one hand, for the healthcare professional to be more efficient, to be quick in what they do, more precise. And for patient, how can we engage them more while we are giving them medical excellence? So one of the first pillar of the strategy of SynLab is definitely digitalization. But it's not a straightforward path. No, we heard this from other speakers as well. Being a company in 36 countries is not so easy. And we can't rely only on open innovation, finding a couple of vendors that are cool with startups and partnership with them. That is not enough today. It's definitely important to go behind open innovation in federated innovation, where basically you can also leverage partnership with some competitors, with other industry. So we really think that this is the future if you still want to be the player that innovates in healthcare. Especially given our footprint, we are also able to be a transactional partner. So not only to think about how digitalization can improve lives of patient or healthcare professional, but also how can we actually put that down to ground? How can we actually make it work in a concrete way? For sure, COVID has changed the world and gave the great push to digitalization, especially in healthcare, and this is obvious stuff. But what really happened is that patients nowadays expect something, and this will keep changing also in the future. So it's really important, if we want to keep giving medical excellence, that we find innovative way to deliver it. And it's important to think about it, because the world will change even more faster in the next years. And I'm talking about artificial intelligence and machine learning on one hand, and SYNLAB already has some great example of in some countries where we are launching a couple of projects, and also data. So they used to say that data is the new oil, and that is really true. So big data, be able to analyze big data, come up with solution, is another bucket that we are really looking into. Finally, let me conclude saying that, generally speaking, there is no digitalization without innovation, and there is no innovation without digitalization. But the most important quote that as SYNLAB we want to bring to the ground, and we really would like to work with all the other partners and can't wait to do it, is think big, start small, and deliver fast. Think big, because let me be a little bit romantic here. A warship in a harbor is safe, but that's not the purpose why a warship was made for. So think big. Start small, because you need to start with a clear steering, because I'm a sailor, and I used to say that no wind is in favor for a sailor if he doesn't know where to go. And finally, deliver fast. And we really think that otherwise we really want to be the transitional partner that makes things happen. So this is what we want to bring to Federated Innovation. Thank you so much. Really looking forward to work with all of you and to innovate all together.
Thank you very much, Andrea, and really appreciate your contribution. Let's move on to another super relevant pillar, which is collaboration. I think we are pushing a lot on this topic. I'm calling on stage again Fabrizio Grillo to give us a very quick overview around how we are thinking about collaboration, how to collaborate with all the stakeholders, and to make sure we can also move the institutions and the funds to provide assets that can be leveraged to deliver results here. I will need to ask everybody from now on to keep it a little bit snappier, because we are running a bit out of time. Thank you.
Thank you. Thank you again, Enrico. Very short, very brief. Let me start with a joke. If we imagine where competitiveness in the same place is running, of course, previous colleagues, Andrea of SYNLAB, and as you know, I mentioned before, we are also CDI, Bracco and CDI, the polyclinic health facility with headquarters in Milan, and with 22 decentralized offices in the city and the Lombardy region. We are making the same services that SYNLAB is making too. So this is a place to be also for competitors to make possible new ways of operation and new projects. Talking about collaboration, Well, collaboration is seen by Bracco as a tool to expand activities and keep contacts with other ecosystems. That's also the spirit of Mind. It is really important to develop relationships between the ecosystem of Mind and other ecosystems in the world, as mentioned earlier. In addition to the value of internal collaboration at Mind, we see the need of a strong importance of creating collaborations as Mind consolidates over time to strongly extend networks with other centers with similar objectives all around the world. So we emphasize what the size of Mind should be at the national level to avoid it becoming a self-referential center. We have the 4 anchors. We have all these systems you well showed at the beginning. So this is the intention to collaborate between different actors, and also between the initiatives that our task force on communication brought to light. There is the planning of meeting the shared priorities on the area of life science with other anchors and with other players in Mind. At the end, let's say bring together these initiatives with the anchor and with the other players is really very important and challenging, and represents in part the private effort to get in touch with investments and partnerships and public sector in this ecosystem, and that will be I think the first exercise that in Italy has occurred in the last years. So we appreciate very much this opportunity.
Fabrizio, thank you very much. To end up the collaboration area, I'm calling Stefano Cantù from the Life Science District. I know as a thematic area, you're putting a lot of focus on joint labs to foster co-innovation while improving tech transfer. What's the plan?
Absolutely. Thank you very much, Enrico, and good afternoon, everybody. Before answering your question, just a few words on Life Science District. Life Science District is a venture builder focused on the life science sector. Our mission is to build the cornerstones of the future of health, transforming promises in value for all the actors that are involved. And so going back now to the joint labs topic, we've been focusing on the joint labs concept because we know that cooperative research is generally much more productive than the research carried out internally. The paradigm of open innovation suggests that sharing ideas, proposals, technologies, and spaces, if managed, favors and accelerates innovative processes. So the point is that the laboratories shared between companies and with universities, those are the places where the exchange and pooling of business and research assets can be expressed in important results, where innovative processes can be carried out in a managed and efficient way. So creating these spaces, however, is not easy. It's not enough to just create a place where equipment is shared or where individual projects are carried out. Joint labs are actually something different and even much more difficult to implement. So the creation of value in the joint labs occurs through the stimulus of interaction between all the subjects that are involved and the external subjects as well, through the development of real co-design and co-development approaches with an interdisciplinary by design aspiration and management of processes deriving from the exploitation of the results between the subjects involved, but also towards the outside world. So the management of those processes of co-development and internal exploitation, accompanied by a focus on technology transfer and startup building, that is what allows the grounding of the activities and distinguishes the joint labs from internal laboratories of companies or universities. So the definition of a joint lab between the actors is basically the basis on which we can build the research, the training, and the transfer of activities and the related shared rules of engagement. Once the core has been defined, it will be then necessary to create a network of links with all the other actors of the innovation ecosystem. And those links will need to be functional to the objectives and necessary to complement the shared access. So, in closing the answer related to the joint labs, which is a very passionate topic for us, the coordination and integration component of the various joint labs, that is going to be the item that will make possible to amplify the impact, both in terms of innovation and exploitation of the results for all the activities and all the actors.
Thank you, Stefano. Again, you've been very, very clear. And we're now quickly moving to the third pillar of strategic focus for the thematic area, which is sustainability and circular economy. And I'm calling Luca Martini from Stevanato. So sustainability and circular economy are recurring topics that are emerging from most of the thematic area and here as well. Can you describe your line of thought and what are the opportunities there?
Sure, with pleasure. So let's start saying that healthcare industry has an important role on sustainable development. Let's think about the impact that we have on people with access to healthcare services and impact on the environment with emissions intensity, which is higher than automotive industry, with consumption of natural resources like energy and water, with lack of adherence to treatments by patients that lead to greater amount of waste due to unused products. So circular economy could be a strategic lever here to reduce the environmental impact, even in our restricted industry driven by regulations. And in this space, we see opportunities in Federated Innovation to discuss about how to redesign products and services in collaboration with pharma partners by adopting a life cycle perspective, how to rethink hospitals and households as key places for the healthcare of the future, and how to identify private and public resources like Recovery Fund, Horizon, that could facilitate the process. So in the end, these opportunities do relate with health and well-being sectors. World Business Council for Sustainable Development estimated about $1.8 trillion of business value that could be unlocked by 2030. So I think big challenge, big opportunity here. Back to you, Enrico.
So thank you very, very much for that. I'm now calling Marco Proietti from Nippon Gases to further describe the initiative planned in this area. I'm asking again everybody to keep this as short as you can, otherwise we will have to cut a few questions at the end, which would be unfortunate.
Okay, well, Enrico, the initiatives in this area are many. The starting point is the basic principle of exploring the possibility to manage waste and making it less impactful for the environment, in particular to reduce environmental impact related to the end of life of all elements involved in the thematic area, such as equipment, drugs, contaminated and delivery solution, and so on. The environment care, basically water and air, are elements that the different companies in thematic area would like to improve. Other relevant aspects regard the analysis of CO2 production sources in the hospitals, energy production from alternative source, emerging microcontaminants in the water, for example, from drugs, residues, and so on. Air treatment systems and the recycling of plastic material and waste management are all this involved in our study. Our proposal is to process could reduce the environmental impact and have an easier management of the waste in the hospital. In order to better direct the work of the working group, we have realized a survey and we have proposed it to a different hospital, for example, Gruppo San Donato and Città della Salute di Torino, and the Hospital of Perugia, Messina, and so on. The objective of the survey is to assess the degree of sensitivity, the maturity, and the possible need of the hospital in the field of sustainability, and the possible interest in continuing the study in order to launch an initiative also related to the favorable condition for investment now. For example, the Italian post-COVID economical sustain plan, the PNRR. The survey was a mix of open questions, which would allow to open debate with hospitals, and some close questions to specific area of analysis. It is intended to define priorities and direct our job. Finally, I want to recall another pillar objective of sustainability and circular economy work group is to promotion of cross-contamination and collaboration between the members of the Federated Innovation. That's all, Enrico. Back to you.
Fantastic, Marco, thank you very much. And Andrea from Accenture, can you come back here and let us know what are the projects of bigger interest in this area here?
Thanks, Enrico. Following your suggestion to be very fast, I mean, I'm trying to, let's say, to shorten my answer. So definitely the pressure to transform the industry toward a more sustainable state is opening a huge opportunity, as we were listening so far. Massive public and private capital investors are definitely finances from climate risk companies to sustainable assets. So I need to stress again what I was saying before. We are really listening the market, also speaking with the consumer patient, and all those trends in looking for sustainable, transparent product and services are, let's say, in the DNA of our population. So more than 80% are planning to buy sustainable products and services in the next year. And this is something that we need to bear in mind, even in this health and life science industry. And the health ecosystem should more quickly be in this trend along all the stages of the value chain. And what we are bringing here all together with our partners here is definitely our global experiences and in leading executing this transformation. So shaping, executing the decarbonization journey towards zero impact, designing and delivering trusted and circular end-to-end value chain, reducing the footprint of IT towards sustainable cloud systems, better planning and measuring the sustainability performances, and developing the sustainable operating models. I mean, are the elements and the skills and the experiences that we are bringing in the table. Just to close, I mean, sustainability, as I said, should be in all the places of the value chains, in the R&D, in the supply chain, manufacturing. We were listening our idea, our exercise that we are doing here in the waste management area. So what is important here is to create a concrete local pilots around maybe a few theoretical areas where we can create a concrete volano, so a small engine that can demonstrate the value, the ROI for all the partners involved, and to speed up the unavoidable transformation that the industry should face.
Thanks, Andrea. You are right, and sustainability is definitely part of everything and is on all the strategic agenda. I've been working with all thematic areas, and sustainability is the recurring word there. So again, I'm asking anybody who is interested can download the strategic agendas of the other thematic areas and check them out. I'm calling on stage Daniel Eriksson and from Beside Me Group, and this is another speaker that I'm very happy to welcome because again is a new player on board the thematic area. I know you guys are particularly active in the sustainability area. Can you tell us how you will support the agenda of the thematic area and describe your objectives? Thanks.
Yes, of course. Thank you very much. Beside You Group and me and my team has created a pretty strong Italian-Swedish group or a partner group related to healthcare sustainability. And this is one of the reasons is why the Nordics, I hope you don't mind me saying, the Nordics has been leading the sustainable healthcare field for the last 20, 30 years, together with maybe the Netherlands. And together with Beside You Group in Italy, we can take that knowledge that's already been done in the Nordic countries and build on that in Italy. And in that way, we won't reinvent the wheel, so to say. You can build on knowledge that is already there. And Beside You Group is also a part of a wider community with, 120 members from 17 countries. So I think we can bring a lot of knowledge to the table, both from the life science side and from the hospital and regional side. Me, myself, have been working with sustainability in healthcare for about 20 years almost. And related to the innovation agenda, me and my team actually wrote a Swedish innovation agenda on sustainable healthcare 6 or 7 years ago, and also the Nordic white paper on sustainable healthcare. So there is a lot of knowledge and a lot to bring on the table that can make this transition into a more sustainable healthcare, a more sustainable industry easier. And this is also a very good initiative, this MIND project, because sustainable healthcare, as we see this, is a truly multidisciplinary or intersectional topic. It spans over clean tech, life science, construction, ICT. So it's neither of these, but all of these in the same time. That also means that when they're talking about innovations, it's not only the life science companies. Life science company must work with ICT companies, construction, the regions, the hospital, etc. And this makes this very, very interesting. And the point is, if you were coming from a company point of view today, sustainability is no longer something that is good to have or you get an extra credit for. It's moving very fast toward a must-have, and this is something we see particularly in the Nordic countries, but also like in Canada and maybe starting in the UK, US also. So this is a global trend that is unstoppable. And as someone discussed earlier today also, when it comes to investors, it's not only on the investors' agenda to only invest in sustainable products and companies. It's also new EU legislation coming this new year, basically for next year, in the taxonomy in Europe. That means that they will classify. It will be harder to invest in companies and solutions that are not working with sustainability. So we are very glad from Beside You Group to be a part of this MIND, and we think this sustainable healthcare thing that we and me has been working with for 20 years fits very perfectly into the ideas that the agendas that the MIND Group have. I think since I was last here and got the last minute here, I will keep this short as the moderator suggested. Thank you.
Thank you, Daniel. Really appreciate your concisiveness. Thank you a lot. We are basically at the end of the block where we explain the innovation agenda, the initiatives that we want to implement as a thematic area. I wanted to ask Andrea Pagliai from Accenture if you can make a quick wrap up here. Is there a red thread along these many strategic opportunities, initiatives which we've been talking about?
Yes, Enrico. I mean, I think listening what we said, you can catch, and anybody can catch those dots. I mean, we are collaborating all pillars: value-based medicine, digitalization, collaboration, and sustainability. But what definitely we are doing all together in all those areas are creating these dots. And these dots are and should be connected coherently to realize the future of the health for all of us. When we are envisioning the hospital of the future that we were listening before, creating the basis for measuring the outcomes of therapy, enabling value-based healthcare models, the first pillar, for example, we're facing the issue that should be solved soon on the data, how they can be shared among all the actors. The second pillar, for example, when we start designing how to deliver and create a new service model, we should keep in the collaborative principle in place to make them real, concrete, and in the daily life, in the business life, in our country. So the third pillar, and creating concrete cases about the sustainability is just to, let's say, move all the fingers in the chain and bring in the new package at home, like the fourth pillar maybe is thinking. So again, to follow your suggestion to be very quick and close quickly, all those dots should be designed vertically, deeply, consistently with all the required skill and knowledge to make them very well done. But we need to design everything following a cross strategy, a unique strategy that connecting all the dots, putting, as I said at the beginning, people, patient, and the human being at the center of everything.
Thank you, Andrea. That was very helpful to have a holistic vision about what we've been discussing about. So I know we're running a little bit late, but before leaving the room for questions, by the way, if you're in the audience, you can click on a chat link on the top right of what you're watching, and you can type a message there that I will receive separately. So you can do that right now, and I will read it later. But I wanted to go deeper on some other elements, and I like a lot to talk about collaboration and participation of a broader ecosystem. I'm asking Stefano Cantù from the Life Science District to talk about cooperation with the broader ecosystem. We mentioned we have an L4 and L5 business community, talent community, and we have startups. There are startups everywhere, and they want to cooperate. They want to do stuff with you. What can you tell us about that? What role can they play?
Well, I mean, thank you, Enrico, for the question. The role is absolutely crucial, both for, let's say, the business and talent community and for the startups. If we go back just a few seconds to the definition of what is an ecosystem, so the sociologist Amos Hawley defined the ecosystem as an arrangement of mutual dependencies in a population by which the whole operates as a unit and thereby maintains a viable environmental relationship. This, if translated to the business ecosystem, is the experience showing us that success within this kind of environment is as much as about helping other firms innovate as it is about being innovative yourself. So the competition is increasingly about identifying new ways to collaborating and connecting rather than simply offering alternative value proposition, just like the other team members were explaining before, and that is shown by the representation of several competitors within the thematic area that are working and collaborating together towards the same objectives. So the startups that are going to be joining Mind will bring their innovative spark to the whole ecosystem, and that will enable them and the community to work hands-on with corporation, universities, and all the other stakeholders towards a common shared goals. And this, I think, is going to be and is the real value in collaborating together, even though we have competitors within this kind of environment.
And thank you, Stefano. And on the topic of startups, I also wanted to ask Laura Antonioli from Novartis, how does she see the potential cooperation with startups? Everybody talks about open innovation and startups. I think we covered open innovation pretty well.
Yes, I love to speak and to work with a startup, and because we see the collaboration with startups as a win-win collaboration. Nowadays, competition is not longer only with the protagonist of the life science world, but also with all the realities that operate there. To be truly effective, playing a role in our healthcare within all the stakeholders involved in the entire ecosystem, innovation become the key to success. That is why it's so important to adopt the open innovation paradigm to open up to the outside world and work in partnership for the co-creation of new innovative products and services to transform healthcare. From the startups perspective, we as a thematic area and as Mind, moreover, we can embrace the mission to allow them to succeed. It's a contributor for the startups ecosystem that is not supported as needed in our country. So I think it is a role that we have to play.
Yes, Laura, I totally agree. It's definitely a role we have to play, and I see enormous value in this type of cooperations. I'm inviting now your colleague Roberto Orsenigo to talk about the lessons we learned from COVID-19 about, we spoke about that before, new business models, cooperation, and so on.
Yeah. Well, I say that the dramatic urgency of the COVID-19 pandemic has led to rediscovery of health and healthcare as a wall of health conditions of a community, of a population, as a public good to be protected and defended, but in a perspective of a union between different worlds that are made up of doctors, scientists, hospitals, academia, research lab, pharmaceutical companies, etc., who have consciously united and shared their skills, occupations, technologies, and cultures to face a common danger. In this case, an infectious disease, those systems we had removed from our collective memory to confine it to history books. We were not prepared for this, despite the fact that since several years, part of the medical community were warning us about a possible pandemic. The pandemic emergency and the crisis of the system, that was a crisis not only in health, into which the global world has fallen, has called us, I would say, first and foremost as individuals, but secondly, also as a community, to build a new way of being together, to take part in a social role that certainly sees us continue to compete, but at the same time, to ensure that innovation is something real, rapidly available, and above all, I would say, sustainable. Without this change of pace, we would have never been able to develop a concrete response. I mean, the vaccine, but also the screening of libraries to search for possible drugs in such short time. And this kind of mindset should continue beyond the COVID-19 because it has demonstrated to be a winning business model, and it would be a real pity if we stop once the pandemic is over.
Thank you. Thank you very much, Roberto. We actually have a very precise question here, and the question is addressed to Marco Gorini, Astra, and Luca Martini from Stevanato. But again, if any other of you want to join in, more than welcome to, if you want to provide an answer. And the question is about cross-sector innovation and public-private innovation. The question is whether there are opportunities to leverage one or both of them. I'm also asking Luca Martini to come here. Let's have this as a bit of a roundtable conversation.
Okay, I'll have a start and then up to you, Luca. Yeah, I think Enrico, there are opportunities, and at least our vision in AstraZeneca is, of course, aligned with the strategic vision of the Mind Group. But I think both of them are really relevant for a very simple reason. So the pre-competitive cross-industry collaboration that we are discussing today can generate value not only for the presence of companies specialized in different sectors from pharma, so we can learn from other companies. Let's think about home care delivery, about remote monitoring, and so on. But also within pharma companies, in a way, we could be competitors in the field, but then we share some common struggles. So regarding some key topics, let's imagine about the use of data. Let's imagine about how to generate value-based care models, or how to define the impact of digital solutions. I think those are very transversal topics where discussing with other companies, this cross-collaboration can generate value for sure. And then moving to the other domain, I think the public-private partnership are effective strategies for drawing together not only resources, but also know-how in terms of expanding and improving the support and services for ensuring that the health system are getting the best advantage that they can do in applying innovative strategies. And so this enables a long-term partnership. I think the strategic approach here is really to work together and to try to foster the creation of solutions that represent a value for the end user. So working directly with the public institution can create a link that is really fostering the impact of the solution. I think in Mind we have very valuable players that we can work together to achieve economies of scale, deploy impactful projects, and ultimately, I mean, the idea is to provide solutions to our patients' needs.
Yeah, totally agree with Marco. And as well, at Federated Innovation, we see opportunities to discuss about new ways to innovate and to collaborate among different sectors. Let me bring here a couple of examples. About sustainability in value-based medicine, we are discussing about how to develop a One Health approach that combines the health and the well-being of the citizen, focusing on the transition from hospital to home care and how to improve the quality of life. And on the other side, about circular economy, we started discussions with both green tech, circular economy, and construction tech thematic areas, as we see potential for opportunities to develop new solutions for the end of life of products related to waste management and water management. At the end, the chance we have at Federated Innovation is to directly discuss with companies and startups along the value chain, and this could accelerate the innovation process, generating a shared value for everyone. And this is a very important thing.
Thank you very, very much for this. And we now have another question. Actually, we see a few questions coming. And it's great to see a reaction from the audience. So I'm asking Fabrizio, Grillo, and Roberto, Orsenigo to join me here. The question there is, what role can the anchor institution, the anchors at Mind, play in the innovation path we just described? Can you comment on that?
Yeah, sure. Thank you. If I may go ahead, Roberto, thank you. Well, it's a crucial role. Let me say that I fully agree with Marco talking about a cross collaboration between the different units, and also with Daniel that also Luca just talked about One Health, which is the concept I have told about we are working on. So it's crucial also the collaboration between private and public sector. The anchors are, let's say, the backbone, let's say the nuclear of our landscape, of our framework of action. So the attention that the government and the local authorities should put on these and are putting on these projects is a win-win project, let's say, because it gives them the many more chances to attract investments, and both from other Italian actors, stakeholders, and from international ones. So let's say the governance of these projects is very articulated and complicated, but it's quite impossible to do this operation without the effort and the combination of the two partners, private and public. If I may spend just the last few words, I heard very interesting topics about environment, sustainability, and AI, artificial intelligence. Of course, Bracco is really engaged on that. Our project AI for COVID is already put on the table of our cooperation. And what I may say more, Bracco has a long history on, let's say, sustainability goals of the production, and also because we are a chemistry company, so you can imagine how much we should put on these two items, on these two tools. So thanks again, Enrico.
Yeah, I would like to take a slightly different thinking, because I believe that because of their role, each of the anchors represents a formidable pole of aggregation for all the organizations, companies, startups, etc., that will come to collaborate with Mind, with a view to sustainability, which must not be understood merely as an environmental sustainability of sort of ecological kind, but truly as a condition of development capable of ensuring that the needs of the present generation are met, but without compromising the ability of future generations to meet their own needs. The generation that preceded me, I have the white bird, the generation that rebuilt Italy, the generation of the economic boom, while committing a lot of mistakes due to a less advanced scientific and technological knowledge, had nevertheless worked to ensure a future for themselves and for future generations, coming out of a dark historical moment and with the nightmare of an incipient nuclear war. It was the time of the Cold War. The anchors, each with its own specificity, but with the systemic integration, must therefore represent, together with the members of the Federated Innovation, first the incubator and then the driver of a sustainable development model. I think we have a moral duty to ensure a tomorrow for our children, and we should remember that.
Thank you, Roberto. We have another question coming from the university world. I'm asking AstraZeneca, Mark, if you can provide an answer. So the question is, I wish to ask, how can university researchers participate in this collaboration effort for innovation in practice?
Well, thanks for the question. I mean, we were referring before not only to private collaboration, but also with public institution collaboration, and this is exactly the goal. I think, I mean, you have the know-how. You have the know-how, and this is really precious for all of us working in Mind. So I think the more pragmatic way to proceed is that now we have just published the agendas, so the strategic agenda where you have, for the first time, seen the domains where we want to land. I think any further contribution can be directly given to us, directly contacting the Mind through the Mind website, the Mind portal. This is not structured as a call for ideas yet, but basically this is a concept. I mean, we want to identify and to work on these strategic pillars. Any contribution is more than welcome to do so. We need to interact with public institutions. So if you want to contribute, if you have ideas, if you know, if you have an experience or use case, that is really important, because we can start with a very specific use case, collect some KPIs, and reiterate. This is the way to make innovation. That is really valuable. So please join us on the website, and we can be in contact there.
That's absolutely correct, Marco. If I can add and complete, If you go on our website now, you can see the innovation initiatives. There is a button somewhere where you can contribute to existing initiative. You can make new proposals, and like rightfully Marco is saying, we will soon be publishing, not only for these thematic area, but for the others as well, very specific call for ideas or call for startups on specific topics. So stay tuned, keep checking on the digital square, like we call it, because that's not a website, is really a digital square where stuff happens. So we have another question. I'm asking Fabrizio if he can join me here, which is how the innovation initiative that we are setting up are value-added services for the community and for the territory.
Well, I mean, I have just already answered on that, because of course it's a strategic project which need really cooperation and collaboration between different communities or territories. Let's say that thanks to this collaboration, the ecosystem can finally be able to play a key role, and will be able also to positively influence the future of the life science. As every one of you know, this year Italy is hosting the B20 and G20 summits, and for the first time Italy is running a workshop and a structure, a group that is delivering recommendations on healthcare. This is a huge success for Italy. It's the first time, so hopefully we will see if the next country which will host the G20 and B20 topics will run again this incredible topic. We are hopefully running out of the pandemic, so that involves all the actors, private and public, and talking about territories in a very strictly view. Well, Italy is not an easy, let's say, country working on it, because we have different ecosystem that try to do more or less the same thing. So the message could be, for the first time, we have the opportunity to have together private and public investors, the anchors, industries, companies, universities. So who knows what is a best situation on which we can work to the final result that should be good, of course.
Thank you, Fabrizio. And as we are approaching the end of the session, I wanted to ask Andrea Pagliai again from Accenture if he can come back here and give his point of view on the question I asked before on COVID-19 lesson learned.
Well, thanks, Enrico. I mentioned at the beginning that we are doing a lot of research. I mean, to always have and to bring fresh view and ideas about the market dynamics, ACP, specialist, and patient and people experience around health. And I mentioned that we just completed the ones globally with the focus on Italy, and it's going to be published in a few days. And the service revealed also how the healthcare experience is changing, especially after the COVID-19 pandemic. People and patients definitely are not so satisfied about their experiences. They are more eager to accept the transformation journey, the digital health integrated solution that we were mentioning during this meeting altogether, and because they are looking for an improvement or to have more easily tools to improve their life. And what is coming out and what I can highlight is that we don't have any single player that seems to be in a position to play alone the transformation journey. and therefore collaboration is a must. It's a must for having more integrated view, for creating better health experience, bringing this not positive ROI effect, thanks to the synergy realized along the entire value chain, touching all the topics that we were mentioning before, and to improve the patient journey for all the actors. That's something that we see concretely listen in the market in the last days.
Thank you, Andrea, for this final view on those topics. We finally got at the end of this session. I want to make sure we end on time, and I really want to thank everyone who joined us. As in next step, we are really eager to hear from you on the digital square. Federated Innovation is live. The journey has just begun, and you can all join in some ways or form. So do get in contact. Thank you. Thank you to all the speakers. I know it's been a tough day today, and thank you to the audience, and we'll see you at the next event.